I am Dr. Karen Smith, a family physician and owner of a solo private practice in Raeford, North Carolina. On Monday morning, October 24, 2005, two representatives from Advanced Med presented to my office with badges identifying themselves as authorized subcontractors for Cigna Medicare and requested 72 charts for review of clinical documentation of services rendered from July 1, 2004 through July 30th of 2005. My staff extracted the requested information from the electronic record system, and I personally provided the walking tour of the building, including inspection of state and federal licenses for medical business operations. The care of my patients was disrupted in our open access rural family practice as patients, pharmaceutical vendors, and other visitors of the practice observed the unannounced review. 5 months later, on March 16, 2006, I received notification that 72 claims with 154 services submitted were reviewed, and 91 of the 154 disallowed for payment. The actual amount paid to the practice for the services questioned was $1,551.11. This overpayment amount, when extrapolated to a sampling frame size of 2,935 patients, resulted in an overpayment calculation of $48,245. However, my practice management system noted I only had 1,287 Cigna Medicare patients in the practice at that time. This discrepancy was never acknowledged, nor was it corrected in the final calculations. The reasons given for denial included incomplete or no documentation, services incorrectly coded, services not covered by Medicare, lack of documentation for drugs administered, services not medically necessary in the judgment of the reviewer who was not a physician. When my staff and I reviewed the summary, we noticed that several items of documentation the reviewer cited as being non-existent were indeed present in our electronic medical record system. I notified Advanced Med of this discrepancy and requested instructions for sending this information. They responded that this information could be submitted only in an appeal. This answer was communicated in such an intimidating and aggressive manner, prompting me to call a well-known independent auditor. I participated in several of her coding workshops and quickly recognized additional professional assistance was going to be needed. At my request, the auditor immediately contacted an attorney who also called Advanced Med only to receive the same answer. The appeal process was initiated and then delayed due to Advanced Med sending letters to the wrong medical office, which neither I nor my counsel ever received. Documentation was finally accepted by CMS and forwarded to Q2 administrators as hired by CMS to review the file and make an independent decision. The outcome from the CMS review was partially favorable in that it decreased the overpayment amount from more than $48,000 to $18,158, a $30,000 error. But it was still based upon an incorrect and inflated number of Medicare patients in my small practice. Our attorney reviewed additional options, including an administrative law hearing for services performed, but required additional appeal presentation. The practice, my family, and myself were at a point of stress never imagined. We were exhausted and emotionally distressed after countless hours and days of preparation and review during our 3rd year in business. Thus, we decided to halt further appeals and review. We were financially drained and feeling the pressure to make payroll, pay mortgage, as well as other expenses. A loan was acquired for my personal home equity and a check sent to CMS to satisfy the obligation. 90 days later, I received notification from the U.S. Attorney Office for a possible levy of assets due to non-payment of the CMS recoupment. After providing documentations 2 times, it was clarified that the payment had not been applied to our debt. I established a technologically advanced primary care practice in one of the poorest counties in North Carolina. This is a practice that adheres to the highest standards of care and participates in quality-based projects and the goal of decreasing medical errors, eliminating redundancy, and state-of-the-art communication with the hospitals located in the region. The guilty until proven innocent audit we endured used sampling and extrapolation calculations which are not properly verified for validity. In addition to the disruption to patient care and possible reputation damage by the surprise and abrupt visit of badge-bearing authorities, the process quickly exhausted our financial reserves. It defies common business sense to run a highly qualified medical practice using records in a financial environment where Medicare does not recognize the true total cost for caring for individual patients with many medical problems. The escalating cost of health care cannot be subsidized for monies taken out of the businesses of small physician practices. We have the compassion and the desire to remain in operation, but will not be able to endure in a world of uncontrolled cost and diminished payment. Thank you for allowing me to testify.